This video will show you how to properly administer Ebglyss using the pre-filled syringe. Please see safety information throughout this video and the indication and safety summary at the end of the video. It is important to read the full instructions for use before injecting. Do not use until you have been shown how to inject Ebglyss by your healthcare provider. If you are a parent or caregiver giving an injection to someone else, be sure to read and understand the full instructions for use before injecting.
All right, now that work is in a good place, I'm ready for a break. Okay, boy, you ready? Let's go.
Ebglyss is taken once every 2 weeks until week 16 or later, with 2 injections taken at week 0 and week 2. If you see skin improvements at 16 weeks, you and your doctor can discuss switching to taking 1 dose every 1 or 2 months, which is once every 4 or every 8 weeks.
All right, now it's time for my Ebglyss injection. At first, I was a little nervous about the injection process, but after learning these 4 basic steps, I've really gotten the hang of it. Before I inject, I'll take Ebglyss out of the fridge. I can also keep my syringe in the original carton at room temperature for up to 7 days, which is handy if I'm traveling. Before I begin, I'll inspect the medicine to make sure it's not expired, and the liquid is clear and colorless to slightly yellow to slightly brown. Looks good to me. Next, I'll wash my hands with soap and water. Now, I'll choose my injection site. I can ask someone to help me inject in the back of my upper arm, or I can inject myself in the front of my thigh or in my belly. Today, I will inject Ebglyss in my belly, pushing the plunger down as far as it will go. I'll clean the injection site with an alcohol wipe and let it dry. Now I'll remove the needle cap by holding the middle of the syringe body and carefully pulling off the cap. Next, I'll gently pinch a fold of skin at the injection site and insert the needle completely into the fold of skin at about a 45-degree angle. Then, I'll relax the pinch and slowly push the plunger all the way down. Sometimes I feel a bit of resistance when I'm injecting, but that's totally normal. Now, I'll lift my thumb off the plunger until the needle is covered by the needle shield. And that's it. 4 steps and I'm just about finished. After my injection, I'll safely throw away the used syringe in the free Sharps disposal container that Lilly Support Services provided. Don't worry, boy. I didn't forget about you. That didn't take long. I'm glad that I can fit my injection into my routine, with only 4 basic injection steps. Now, I can get back to my day.
Indication and safety summary. Ebglyss is an injectable medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds, 40 kilograms, with moderate to severe eczema, atopic dermatitis. That is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. It is not known if Ebglyss is safe and effective in children less than 12 years of age or in children 12 years to less than 18 years of age who weigh less than 88 pounds, 40 kilograms. Warnings: do not use Ebglyss if you are allergic to lebrikizumab-lbkz or to any of the ingredients in Ebglyss. See the patient information leaflet that comes with Ebglyss for a complete list of ingredients. Before using Ebglyss, tell your healthcare provider about all your medical conditions, including if you have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Ebglyss, are pregnant or plan to become pregnant. It is not known if Ebglyss will harm your unborn baby. If you become pregnant during treatment with Ebglyss, you or your healthcare provider can call Eli Lilly and Company at 1-800-LILY-RX, 1-800-545-5979 to report the pregnancy. Are breastfeeding or plan to breastfeed. It is not known if Ebglyss passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Possible side effects. Ebglyss can cause serious side effects, including allergic reactions. Ebglyss can cause allergic reactions that may sometimes be severe. Stop using Ebglyss and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, hives, itching, fainting, dizziness, feeling lightheaded, skin rash, Cramps in your stomach area, abdomen. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. The most common side effects of Ebglyss include eye and eyelid inflammation, including redness, swelling, and itching. Injection site reactions. Shingles, herpes zoster. These are not all of the possible side effects of Ebglyss. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. How to take. See the detailed instructions for use that comes with Ebglyss for information about how to prepare and inject Ebglyss and how to properly store and throw away, dispose of, used Ebglyss, pre-filled pens, and pre-filled syringes. Use Ebglyss exactly as prescribed by your healthcare provider. Ebglyss is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injections of Ebglyss, you or a caregiver should receive training on the right way to prepare and inject Ebglyss. Do not try to inject Ebglyss until you have been shown the right way by your healthcare provider. In children 12 years of age and older, Ebglyss should be given by a caregiver. If you miss a dose of Ebglyss, inject the missed dose as soon as possible, then inject your next dose at your regular scheduled time. Learn more. Ebglyss is a prescription medicine, available as a 250 milligrams per 2 milliliters injection pre-filled pen or pre-filled syringe. For more information, call 1-800-545-5979 or go to ebglyss.lilly.com. This summary provides basic information about Ebglyss, but does not include all information known about this medicine. Read the information that comes with your prescription each time your prescription is filled. This information does not take the place of talking to your doctor. Be sure to talk to your doctor or other healthcare provider about Ebglyss and how to take it. Your doctor is the best person to help you decide if Ebglyss is right for you. Ebglyss, its delivery device base, and Lilly support services are trademarks owned or licensed by Eli Lilly and Company, its subsidiaries, or affiliates. Voice over audio created using AI.